Good afternoon and welcome to another episode of Ask Mr. Long Island. My name is Michael Watt, aka Mr. Long Island. Our guest this week is Ken Greenberg from Patient Innovations.
Thank you,
Ken,
Michael.
thank you for joining us. And each
My
week
pleasure.
we get together and we discuss programs, organizations, and companies that really reflect well on Long Island. And even though what you're doing, which is very exciting, isn't necessarily Long Island centric, I think the fact that the people who put the idea together really just shows the quality of entrepreneurialism that's coming from Long Island. But I'm getting a little ahead of myself. Tell us a little bit about Patient Innovations.
Okay, well, Patient Innovations is a medical software company, and our first product is on-time care.
Okay.
And in fact, we got a couple of slides here just to
Well,
show
now we're going to raise the bar for our audience, if that's all right.
because
Go
I've
ahead.
got slides, but not too many. So we say we have the brightest ideas in patient care because this is a completely different way of looking at how doctors schedule
Okay.
and treat patients. And there's a big move in patient experience today. Hospitals are hiring folks from Disney and the Ritz-Carlton to improve the patient experience, but I don't see them talking about the wait. And if you wait an hour and a half to see the doctor, you're already not having a good experience. So we take care of that. We take care of patient engagement and communication, which they don't do. So the product is called On-Time Care.
Okay.
And this provides total dynamic patient engagement, but it also schedules more intelligently and helps doctors become more efficient while eliminating the waiting for the patient. So it's a win for the practice, it's a win for the patient. We're pretty excited about it.
Well, the doctors are facing a challenge because they're getting, their compensation's getting cut back, so they have to
Unbelievable.
add more patients with the understanding or the hope that some of them don't show up that day.
Right. But they're overbooking
Right.
to avoid potential holes in the schedule. And part of the reason for that is, I think Medicaid pays a typical office visit, it's like $7 now.
Wow.
That's gross.
Jeez.
You have to run an office. It's impossible.
Right.
They cannot afford a hole in the schedule. So not only do they overbook, they overbook. And you see it sometimes when you go in for the 10 o'clock appointment, there's 5 other people in there for the 10 o'clock appointment, because maybe some people did not show up or cancel that
Right.
day. We've solved that whole problem, so you don't even have to schedule ahead. But we'll cover that in a second.
Sure.
Let me take you through a couple of little things here. It's incredible technology. I was very fortunate too that in 2013 we partnered with United Healthcare. I happened to meet this great guy, Jeff Walter. He lives out here, Long Islander.
Okay.
He's the CEO, and he heard me mention on-time care, and ultimately they actually featured us in a booth they had at the Las Vegas Consumer Electronics Show.
Wow.
A year ago, January. They didn't
Okay.
take one this January. They had even talked about featuring us as enter us in the contest of all the technologies, but they didn't go this year. So that's pretty cool. And they funded the build out into an enterprise level system.
Okay.
And we are basically 2 different major components. One which we actually created for a practice they own in Las Vegas, we call visit flow tracking. And this is where we can identify the inefficiencies in a practice. We're thinking large group practices, large hospital settings with busy faculty practices. But this actually uses an RFID system so that every room has a little transmitter inside, and it sends a signal to a badge. I should be wearing one now. It says I'm losing weight, W-A-I-T on it.
Okay.
And it's got a little reader on it that gets the signal from that transmitter. So when you check in as a patient, we give you a badge at
Okay.
check-in. Now, when you're sitting in the waiting room, we know you're in the waiting room, we know how long you're in the waiting room, and we can display this on screen for the practice managers.
Wow.
Every room you go into, whether it's an exam room or let's say OB could be an ultrasound room, maybe the doctor's office for a consult, we know where you are and how long you're there. Now, let's say from the waiting room, they stick you in an exam room, and you're in that exam room half an hour. You always
Right.
get in the exam room and think, oh, finally I'm gonna get, they took me relatively soon, it was only a half hour. I'm in the exam room now, the doctor will come in any minute, and then you could be there for 45 minutes.
Right.
We see how long you're there, and we can notify people, hey, Michael's in room 2. And we can do this when we know the doctor's not even with another patient. So he can get an alert saying, Michael's here. Because they use these flag systems where they'll turn a flag on the door outside the
Right.
hallway. But that doesn't tell you who went in what room first.
Right.
They can go into the room over here, you just got in 5 minutes ago, the guy down the hall could have been there 45 minutes. They don't even know. So it's really messed up.
So you bring in the practice, the patient care part almost up to speed with the technology of the medicine that's being
Exactly.
provided.
And the doctors also get badges too, and not just the doctors, medical assistants,
Sure.
technicians, nurse practitioners. So we know when the doctor walks in the room with you, or even a medical assistant checking your blood pressure, how long they're all together.
Wow.
So the system then, on-time care smart schedule piece, will actually predict the start and end time, the correct time, not just the 15 minutes that all practices book every 15 minutes.
Right.
We'll actually calculate the start and end time for the appointment.
Wow.
The actual time the doctor's gonna need with you, based on the reasons you're coming.
Wow.
And most $200 million software systems in hospitals, they can do all this great stuff, but when they put you in the calendar, part of the schedule, the only thing that shows there is your name. They don't
Wow.
know why you're coming,
Right.
or how serious your appointment is. So we take care of all that. In
All right,
fact,
I'm gonna jump in there, because
Okay.
we're gonna go to the next segment, take a break for a couple
Okay.
minutes, but this is phenomenal.
Thank you.
As somebody who just suffered through my annual physical, God bless you, Ken. You're watching Ask Mr. Long Island. My name is Michael Watt, AKA Mr. Long Island. Our guest today is Ken Greenberg from Patient Innovations, and we'll be right back.
Hi, I'm Tim Stead from Star Communications. We're a marketing support company. And if you need help with your next marketing project, please call 273-1900, or you can go to our website, starcommunications.us.
Good afternoon and welcome back to another episode of Ask Mr. Long Island. My name is Michael Watt, AKA Mr. Long Island. Our guest today is Ken Greenberg from Patient Innovations. And Ken is walking us through what Patient Innovations is all about. And I got to tell you, this is some really cool stuff. So why don't you get right back to it?
okay, so we help eliminate waiting in doctor's offices and optimize the practice. So in the previous segment, I showed you a diagram for our RFID installation. So patients get badges when they check in, doctors and medical assistants, everybody wears badges. And this is a screen that kind of displays what's going on. So this is a waiting room, and there's actually 5 clinics that can be displayed in this particular scenario. These are the exam rooms. Down here are the doctor's offices, which have their names on it. So when you're in the waiting room, you may start off green, but after a few minutes you turn yellow, and after a few more minutes you turn orange. Then you turn orange with this red outline, then you're red. Then we can blink it, I mean, depending on how long you're gonna rot there.
Right.
And then when they put you in a waiting room, you're blue when you're alone, it indicates who you're scheduled with. But if you're still waiting for a doctor after a certain amount of time, again, this changes color to even go red. And the beauty of this thing too is it lets doctors know who's waiting where.
Right.
We could even text them or send them this information to their iPad or whatever. And if you click on one of those tiles, it pops up this thing, which gives you a summary of how much time has the person spent. This gives you every single place they've been or every badge event
Wow.
that gets measured. But we'll summarize it here. So this person was waiting in the waiting area for 40 minutes, spent 14 minutes in the ultrasound room, 20 minutes in the waiting room. That's for the patient. And down here shows the doctor and how many minutes they spent, only one event. If 2 doctors or a nurse and a doctor came into the room together, or different people saw you, this bar breaks into 2 or 3 or whatever, and you can see what everybody's doing there. And then we have this component called SmartCom that does all the communication that the doctor will, or the nurse, or even the office manager will never do and tell you about. So if the doctor's running late, despite everything we'll do,
Right.
we'll send you a text that says, hey, Michael, I'll come 11, come 12:30.
Right.
That's before you come. But let's say
That's to your cell phone, to your text.
your smartphone, we
Right.
can send you an email, we can
Right.
give you an automated call if you're elderly and prefer that. You can respond one to, let us know that you got that, and you will come at that later time. That's before the arrival. But after you've arrived, how many times you're sitting there for 45 minutes in the waiting room, could I go out and get a sandwich?
Right.
Because you see it's crowded. We'll send you a text even after you arrive, say, hey, Michael, Dr. Boutros is running 45 minutes behind. Would you like to, do something else? And you can, right? We also have this thing called the ANIM, Alternative Doctor Available message. So let's say another doctor in the practice is free, and your doctor's backed up. While you're sitting there, we can let you know, hey, Dr. Boutros is backed up 45 minutes, Dr. Greenberg is available now.
Okay.
Reply S to switch your appointment, K to keep it. And then if you switch, we put you right in. If you walk off the grid with your badge, we know we can send you a badge alert. Michael, can you come back with the badge? We give you standby alerts. Sometimes you want to make an appointment with a specialist, and they tell you, oh, we can get you in 5 weeks. 5 weeks, I got the pain today.
Right.
But we'll put you on standby,
If
and
somebody
as soon as
cancels.
canceled,
Wow.
we'll send you an invitation to take that earlier appointment. We'll even do the same for no-shows. We'll anticipate and fill the no-show through reminders. If you haven't responded to any of our reminders, which are all interactive, we might say, hey, this guy's not coming. Let's fill it with a standby appointment.
Wow.
We can send thank yous, personalized surveys, by text, email, or automated call. We can even do health minders, which is one of our things where we'll actually remind you 3-4 times a day, take your meds, whatever, so you stay with the doctor's orders and you do better, less likely to be readmitted.
Well, you hit on something before. You said it makes the doctors more efficient. It kind of also makes the patients more efficient. You don't feel like, and I've sat in a room wondering, did they forget about me? And of course, you're not in a position to go walking down the hall looking for people.
Right. So we really handle that communication and engagement, and our smart standby piece will actually calculate the correct amount of time. We have doctor alerts.
Okay.
So, you know, if instead of doing 15 minutes, maybe they'll need 8 minutes, maybe they'll need 35 minutes. We calculate the right amount of time for everybody in the workforce. And then we can let the doctors know if somebody's waiting. We don't bother them if they're with a patient, because we can see that.
Right.
But if they're alone, and remember, if the doctor was busy and we sent you an alternative doctor available message, we can send the doctor a plan. He's free now.
Okay.
And I say, hey, Michael's in room 2. He was waiting for you 45 minutes. He knocks on the door and says, hey, Michael, I'm really sorry I was backed up to 45 minutes, but you know, you're in with Dr. Green now. You're in good hands. Just want to make sure everything's okay and check in on you. You feel like $1 million. Took you 15 seconds.
Well, as long as you know you're being accounted for or catered to, I think people tend to be a little more patient.
People like that. Look, people pay more to buy jewelry in Tiffany because they're getting an experience. Same thing at Nordstrom. And the same thing should apply to doctors. I think that's what the hospitals and the large practices are doing by trying to get people in from the Ritz-Carlton to help with the experience.
Well, it just seems for years the healthcare industry, the technological advances focused on the medical care that was being administered. It seems to me what you've done here is kind of bring the rest of the industry up to speed.
Well, you know, you hit on it, Michael. We actually call it patient innovations because we figured we're going to do this for the patient. Let's eliminate waiting in doctor's offices.
Sure.
What we found in our system is, gee, the doctor comes out even better because they're able to see more patients without the need to overbook. All the stress goes away.
Right.
Because nobody's complaining about, how long am I waiting here? You know, that goes away. They see more patients, they make more money, and everybody's happy because the patient's not waiting.
Now, if somebody wanted to get in touch with you about this, I know there's not a lot of information out there because you got patent pendings and all that, but is there a website they can go to?
They can go to patientinnovations.com and they can see a little bit about what we're doing and get my contact information. You hit on it. We have 10 patents pending, so we haven't put a lot of information on the website.
But the contact information is
Absolutely.
there. And really, this is tremendous proof of my theory that Long Island is going to become known for really smart, innovative, entrepreneurial products. And so thank you so much for doing it.
You know, Michael,
here.
we put a man on the moon from Long Island. So from Long Island, we're going to eliminate waiting in doctor's offices.
Which is probably a more impressive accomplishment. So, Ken Greenberg from Patient Innovations, thank you very much.
Appreciate it.
This has been another episode of Ask Mr. Long Island. My name is Michael Watt, a.k.a. Mr. Long Island, and we thank you for your time and attention as well.